if I take 1 milligram of CBD, I'm out for 36 hours. So I think it is crucial to start low and work your way up. So for some of these guys, we may end up at 5, 10 milligrams per day. For some of them, I've seen doses in the industry as high as 200 milligrams per day for more serious conditions like cancer and things of that nature. Hey, I'm Dr. Ruth Roberts, and with me today is Sandy Reynolds, one of our certified holistic pet health coaches. And I am so delighted that you are able to join us today because we're going to talk about something a lot of people struggle with, and that is canine cognitive dysfunction. But before we jump into that, if you do not know Sandy, she is one of these folks that joined the Holistic Pet Health Coaching Program because she needed a pivot in her life. She had a very successful insurance practice, but really stressful. And so what she knew she needed to do was to work with pets. And her oldest dog was indeed the inspiration for learning and taking the course. Western vets weren't able to support her very well with the digestive and gastro issues that her pup was experiencing. And she found help at an amazing pet food store while she was on vacation, talking with a trained staff. So it was that transition from illness to wellness just with food that made you really take the leap, Sandy. So welcome. Thank you.
Thank you for
And then,
having
so why? Yeah. So glad you're here. How did you get into cognitive dysfunction, canine cognitive dysfunction? Why is that a topic that's near and dear to you?
I think because I work with a lot of senior pets and my clients, they notice things just like you do in aging adults and human people. And it's just heartbreaking to see them go and stand in corners or turning in circles or being up all night. And they want to know what they can do because it's so scary, and I can't tell you how many people have mentioned to me that, "Oh, I had to put a dog down because of that," because their vet didn't give them any other options, and they really didn't know how to manage it well, and they felt bad for the pet because they seemed stressed and they were anxious and they were keeping them up all night and those kind of things. So, I think that it's great you bring it to a topic that people can talk about it and realize that we do similarly have health issues to our pets and our animals. If we can help people, obviously we can help them too.
Right on. And I think that nutritional management is step number one. In people, we know that Alzheimer's has been called state type 3 diabetes for almost 15 years now. And I think diet certainly contributes to the symptoms that we see in our older dogs. So you mentioned a couple of the symptoms that people might experience. So the dog is up all night, pacing, keeping them up, standing in a corner lost. Are there other ones that people would want to look for to know that this may be what's going on with my dog?
Yeah, sometimes they turn circles or they maybe stand and stare at things like they started walking to the other room but forgot what they were going for. We can all relate. um,
Uh,
That happens. Panting, seeming a little bit stressed out. Some people think that just panting is pain, and some that's anxious anxiety. And so sometimes supporting them with mushrooms or other supplements, along with an anti-inflammatory diet, can really help them process and manage it.
right on, because this is the kind of the frustrating thing, right? Because we're accustomed to a system of medicine that once the diagnosis is delivered, that's the outcome. And when Audrey asks a great question, is there a way to tell if they're standing in the corner because they're painful and anxious and don't know what to do versus CCD? So that's where I think a veterinarian can be super helpful. But for a pet parent, what are some other things they might do to help decide, oh, wow, okay, no, this is not CCD, this is something else?
I think most people, you know your pet, so you want to run down feeling through their body, making sure that they're not having pain somewhere, putting things together. Oh, they haven't been eating, or do they have any other kind of symptoms so that you can rule out if, they're in pain or having something else going on.
Right on. And I think that's really critical too. That's our colleague Beth Princiar teaches nose to tail check through every day, just to so you know what normal is and where things are starting to change for your pet. I think as our dogs especially get older, and cats too, it's important to really check in with them physically. Is there something that hurts? Is there something that's creating distress that would create this behavior? Precisely. When we talk about when you're working with your clients with senior pets, what role do you think nutrition plays in managing cognitive decline and the anxiety that may come along with it in these guys?
I think a lot, just like you mentioned, dementia in humans is called the third diabetes. I can attest to that. My mother died from heart complications, but had dementia. And her diet was so terrible. Literally, she could have eaten sugar 100% of the day. And she was like that my whole life. She drank 6 cans of Pepsi a day. And
Wow.
seeing what happened to her at the end of her life and watching her memory fade at such a young age, it really brings front of mind for you about how you want to feed your pets, how you want to feed your own family. I wanted to go the complete opposite direction of that. And when you have inflammation and swelling in the body and things passing the blood brain barrier, it's going to affect the brain. And that's why we do things like CBDs and mushrooms, because you can help get rid of that inflammation and help the immune system at the same time, as well as give them the calming effects that some of these supplements offer.
And that's so true. And it's really interesting. Actually, there was on the human side, there was the research that said, oh, yes, it's the beta amyloid plaques causing Alzheimer's. And then finally, I think about a year and a half ago, they're like, oh, sorry, we falsified the results on that. So that took research on Alzheimer's in particular down just the garden path. But what is being found is that actually microplastics and nanoplastics may be responsible for allowing some of those things to accumulate in the brain. So there's a whole nother level of understanding what's in the environment and things that you can do to detoxify and pull some of those materials out of the body. So that's where something like a fulvic acid, humic acid, like a carboxy would be super useful there too. I think that's it. Regardless of where you are, if you're feeding an ultra processed pet food, um, for a lot of people, it's daunting to think, oh, what do I do now? So, what are some tips that people could start transitioning from that ultra processed food onto a more whole food diet?
Absolutely. I like to talk with my clients if they're not ready to do that full switch yet. And it's funny, a lot of people think their dogs won't eat veggies and different things like that, but some are picky. However, if you start making toppers, just get some, you can even just start at the beginning, go get some mixed vegetables in the frozen section and steam that up. And depending on your dog's size and how they eat, obviously, just like people, some dogs like their stuff chopped up really small. A lot of dogs will just eat a cut piece by itself. Start by putting a little bit on top of the kibble and watch their reaction and see what they do. It really is quite exciting once you get your pet on a whole food diet to see the transition in their body. Older pets also getting the inflammation and maybe excess carbs from a kibble out of their diet, little lumps go down, their body starts to look better. They may actually lose some of that fat weight that they didn't need, that may be contributing to other senior issues like they can't move as well, they can't jump on the couch anymore or the bed or those kind of things. So that's a whole different list of health issues as far as joints and that kind of thing, but it really benefits them and their whole body so much. I just encourage people to start by a little bit and give it a try. And any of us pet health coaches are happy to help people if you do want to transition and get onto an anti-inflammatory diet. It's wonderful because if they have other health issues, we can combine different things or different supplements with that cooked diet or raw diet, whatever you choose, and help with other symptoms as well.
Said. That's the big thing is that it can be super daunting to figure out where to even start for your pets. If you've been just following the conventional pathway, and I'm not trying to throw my colleagues under the bus here, but simply to say that Western medicine just doesn't have a lot of good options for these types of chronic disease. And there's a few supplements that are available that may be helpful, but a lot of time, if we just throw pills at it, we're not getting at the root cause. So I think that's what's so critically important is to make sure that we're getting at the root of the issue so that we're not just ignoring the thing that's creating the fire. So well said there. And what are some of when you're working with a client that's got up with cognitive dysfunction, what are some of your favorite tools to start with? Do you just start with diet or do you start adding supplements or how do you typically proceed
Well, it
with these
really
guys?
yeah, it really depends because if they have kidney issues, liver, anything else going on, we have to look at the whole picture first. But absolutely, diet is the first thing to change. And we go from there. Incorporating things like a pulsed electronic or magnetic frequency pad in the calming mode can really help them if you can get them to even lay next to you or put it into their bed and they feel comfortable there. You can get mushroom relaxed chews if they're keeping you awake at night and having a problem settling and relaxing. Because boy, it's hard when they sleep all day and then they're anxious and upset all night and they don't want to sleep. So obviously
Right.
start with the food and then we go from there.
Right on. And I think you're exactly right. And it's exhausting to us too. If you're up all night with this dog that's pacing, it is just not fun. So it's really important to look at the whole perspective and work on the things that are creating the most impact at the time. And I'm trying to drop a couple of links for us too that so people can understand what's available to them. But I think, Ren, you brought up a point that sometimes keto diets help. So MCT oil will actually induce ketosis just with one dose. So that's a great strategy. Yeah, and and that's it. Ren's asking about balanced diets that should be recommended. Um, and I don't know where you've been, Ren, but I created the original CrockPET Diet back in 2006. It is complete and balanced for all life stages according to AFCO standards. And we do have supplements for it that include glandular materials, as well as a supplement called Daily Wellness that is just the materials that are needed to balance the diet. So if you don't know this, check it out. That's the basis of what the coaches use to help determine where to start. That, and then the other tool is Glacier Peak's Pet Wellness Scan to help us understand what food sensitivities may be present so it's easier to manipulate the diet. So check those out. And that's it. Rena, and so this is it. I've been teaching people to home cook since 2006, right at the advent of the very first pet food recall. And that was Man, that was a true test of the CrockPET diet, and it came through with flying colors. So for Sandy, for folks that are like, "Oh, I can't cook," yeah, are there other diets that you like to start people on if they're trying to transition into that?
There are a few commercial ones. It really depends on the pet in specifically, because just like you said, if we've done a sensitivity test because they have issues, itchy paws, yeast, all kinds of stuff like that may limit us to how many commercial options we have. There are plenty available that may work for your pet. So it's just one of those things where we have to get in and see what works for them.
Agreed, and that's it. This is where we all want the blanket statement, but the truth is that each individual dog needs different support. So I think that's where Glacier Peaks test can really help us hone in specifically, because the idea is that if there is leaky gut and part of the leaky gut is caused by what the dog is eating because they've been developing sensitivities to it, if we continue to feed those foods, no matter how good they are or superfoods or whatever and create that inflammation, we're just exacerbating the brain dysfunction. Super important there.
I
Um,
find
and
people Oh, go ahead.
please.
No, I find that people order so many supplements because they're trying to throw something at that situation. And when we start with the gut, do the testing, and remove the items that are bothersome to them, you probably don't need 95% of those. And we may need to just adjust a few or maybe something different. But in the long run, you can save so much money by just starting out that way from the get go.
Agreed, and that's it. So I mentioned this at the beginning of our discussion, but we tend to, because we don't get the support we need from conventional vets, we tend to go online and buy all sorts of stuff because it's got great testimonials. And the thing to realize is that may or may not be appropriate for your dog. And if we work on the basics, then we can often find out that we really just need one or two supplements to cover some basic steps like controlling inflammation or liver detoxification assistance. And really, that's it. Tanya's asking CDC oil. I think you mean CBD oil, if that's correct. Yeah, that can absolutely be appropriate to try and see where we get some response or don't get some response. And especially for those dogs that are really anxious, I think that's been super helpful. Have you found that with your clients, Sandy?
Absolutely. Lion's mane is a big one, obviously, for cognitive function. Reishi and cordyceps as well. You can do a Clarity CBD oil that has all of that in it and a few other things. It's definitely one of my favorites. I like to also do a mushroom supplement for immune and some other things like that with my own personal dogs. But that's one of the things that when we work with someone, we're able to go off of all the information that they provide and come up with what is going to work best. I am more of a less is more, just like you said. Once we fix the diet and we can really adjust some things there, it makes a huge difference in the pet. And you maybe don't have to go the route and add a bunch of different stuff or maybe medications, different things like that.
Right on. Now, I agree with you. I think Clarity has been very useful for anxiety, and that's a mushroom tincture, which is super awesome. And then CBD, there's some interesting, there's full spectrum CBD oils, and then there's some that have extracts or isolates. Usually, extracts are a better option, but CBN may be a really good option for pups that are super anxious and nervous and have the canine cognitive dysfunction. Yeah, so Tanya, that's exactly it. Anxious dog pacing under your feet and staring at walls. They're just totally checked out. So that's where if you've already talked to your vet and they're like, "Yeah, I don't see anything. I think this is CD. Here's a couple of things you can try," and you're not getting results, that's where using like PEMF, so the Pets PEMF pad we put a link to in earlier, that's super useful on the stress or anxiety setting. And this is where CBD can be super helpful. And then the mushroom relax chews I like a lot as well because it's tryptophan, theanine, passion flower, and then valerian root for calming, and then lion's mane in there to help support brain function too. So those are all good options to try. And again, part of what we as coaches, what we want to do is make sure that we're supporting the symptoms that are really creating havoc in the dog's life and in our lives. And so those are great stopgap measures until you can really pull a full plan together. I think we've covered this topic really reasonably well. Is there something we've left out about CCD that you think we need to include in this discussion?
Boy, I don't think so. The hot topic, get the diet adjusted and then the appropriate supplements. I'm with you though. I really the CBD and mushroom combination. They coexist very well and I see a lot of good results. And the mushroom relaxed chews, I have so many clients that will message me after even just trying them for a little bit and say, "Oh my god, I can't believe how good they work." If somebody's willing and wants to buy a supplement or something, at least we know that one is more in line with what we feel we would be giving anyway, and I wouldn't in any way say it's a waste of your money.
Exactly. And the other, in terms of supplements, the other one to consider is ergothioneine, which is showing some really interesting results on the human side. There was a study of people that were like pre-Alzheimer's, pre-dementia, and they took this supplement at, I think, 20 milligrams per day for 6 weeks. And at the end of the 6 weeks, their scores on cognitive function tests had improved by somewhere between 30 to 40%. So this is another one. Um, this is another one that is really quite useful to consider. So I think we're going to see a lot more about that in the pet industry. And mental stimulation, Audrey, I think that's critical. So what are some things folks can do to help keep their dogs engaged mentally? Have you
You
got
know,
some tricks on that?
I do. There are some of those little puzzles, if they have a favorite treat or something that you wanna put in there. A snuffle mat also, it gets them using their sense of smell, especially sometimes older dogs maybe can't walk as far or can't go outside and do a long scratch and sniff walk or something like that. You can do things inside your home so that it's within the safety for any health concerns, or sometimes they get a little anxious if they're outside and there's too many people, too much noise, cars, that kind of thing. Keeping it inside and working on those things can help.
I think that's really wise. It's very things shift in their brains in terms of what they're responding to outside. Just being cognizant that if traffic is really freaking them out, to get them outside, but get them in a safe place so that there's not so much impact. So, Rena, you're right. If we can get them outside for a walk in a stroller or a carry bag, I think that's super helpful. But traffic freaks them out. Maybe you're going to drive them to a small local park and then just do a scratch and sniff walk around there. Right on. And Tanya, it's this is frustrating. It's very bizarre how each state regulation is for veterinarians being able to discuss or not discuss. So strangely, in California, the state that had first legalized marijuana, both medically and recreationally, veterinarians are prohibited by the state board from discussing CBD. So there's a couple of them out there. CBD Dog Health is a good brand. Earth Buddy is a great brand. We've been using Rooted Owl for Hio for her anxiety component. I've been very pleased with the results on that. And we use one of Earth Buddy's products called Mobility to help with the pain that she has secondary to her arthritis. So, what I would encourage you to do is to think about what symptoms your pet is experiencing and then choose a product based on that. The other thing you would want to consider too is that the dosing is super variable for each pet, right? Sandy, how do you discuss with your clients how you would start dosing CBD products and what their in dosing or in dose might be? The
Absolutely,
goal there.
because you can't overdose them. So I always caution people, don't panic and worry about that. This is not the high like people associate with using marijuana products or something like that. This is CBD. I like to have my clients just start small because, for one, we want to make sure that they don't have a reaction to the MCT or whatever kind of oil that it is in. So we start slow and then we just gradually increase a little bit until you get the desired result, because a big dog might only need a half of a dropper and a little dog might need three quarters. It really is dependent on to how their receptors react to it in their body, same as people.
Yeah, right on. It's crazy. We have Ohio is taking around 40 milligrams of CBD total per day, and she's just cruising. She's doing great. If I take 1 milligram of CBD, I'm out for 36 hours. So I think it is crucial to start low and work your way up. So for some of these guys, we may we may end up at 5, 10 milligrams per day. For some of them, I've seen doses in the industry as high as 200 milligrams per day for more serious conditions like cancer and things of that nature. So it really is individual, and you have to watch your dog. Where's the point? Where's the sweet spot on that dosing? I think that's Awesome, awesome. Yeah, yeah, and so all good stuff. If we've got a senior dog and they're just starting to do some kind of peculiar things, so we're pre-diagnosis, where would you start in terms of supporting these guys to help prevent this issue from becoming an issue?
That's the perfect time to start with diet if you're not already. Get that dialed in, and then starting with a mushroom supplement just because you want to support that brain function. Lion's mane is amazing, and I've seen really good results. And I also know a few humans who have tried it for themselves that they feel like they've had a little bit of cognitive decline, and they can actually speak to us and they report the same type of benefit.
Exactly. So, this it's just and this is why we end up sounding like broken records, right? Because it's the same basic steps you need to start with and then see what that takes care of. And then from there, you can make adjustments on what needs to happen next in terms of adding more supplements, taking them away if they're not working. And Audrey, exactly, exercise. So that's been really clearly shown on the human side. If you're not moving, your cognitive function declines pretty quickly. And that makes sense because you're not getting those big bumps in blood flow that really get things moving through all of the tissues, not just the brain. But that's critical as well to keep things moving. If you've got a 12-year-old dog that's been a couch potato, that gets a little tough. So how would you start off a dog that's been basically sitting around for most of its life?
Got to start with small steps. If that's getting the dog out and going 2 houses down the street and coming back, but you just increase it and you do more and more every day and frequency too. So if the dog can't go very far, then take them for 5 times a day or whatever works, but just build up and increase on that. And you'll notice a difference. They'll get a little more pep in their step. They may lose a little weight. But just like people, when we start to work out, it's really rough to do a long, hard workout the first time. So just start slowly and ease them back into it.
Right on, right on. Yeah, and Rena, that's it too. Omega-3 fatty acids are great for brain function, and the PEMF mats are amazing in terms of improving um, brain function. And I think part of what happens is the brain is able to be assisted in rewiring, so to speak, so that different things fire differently instead of the same old pathways. I think this is a lot of it is so simple, but if you're a pet parent and you've been kept awake for 3 months in a row, your ability to think through things really gets difficult. And this is definitely where working with a coach can make you get the results faster or help you get the results faster because a lot of things are really if you're in the middle of it all of the time, these are it's really frustrating to see a way out of it. So tough stuff sometimes. So Tanya, what we're talking about is a PIMF mat is a pulsed electromagnetic field generator. And this mat, PETS PIMF, has been super wonderful in terms of working with these guys because it's been so highly effective. So I've used a CC loops in the past. They work really well. But the downside is that if you've got a dog with arthritis and also cognitive issues, you need two different mats versus this mat, you need one. And the cool thing is that it is set up to be adjusted on your cell phone app between what type of treatment protocol is being run. And so you can literally, with a tap on your phone, there's a little video of me showing Hayo enjoying it, but literally with a tap on your phone, you can switch between anxiety and stress relief to pain relief to sort of a accelerated healing if there's been an injury. And then there's a new integrative real setting that allows you to combine that healing, accelerated healing with pain relief, which has been super easy. Yeah, and Rena, you're absolutely right because and this is what happens on the human side too, in advanced disease, we tend to just end up sedating people so they don't hurt themselves and so that the caregivers can handle things more easily. But it's really frustrating to see that because basically then we're just warehousing people and animals until their bodies give out. Um, so it's a really is a critical thing, and I think to know that there are other options is amazing. And Ren, this is a great question. How is PEMF different from harmful EMFs? And that's how PEMF works is it's able to bring chaos into the electromagnetic field within the living organism. So EMFs create distortions in that field by creating chaotic waves of electromagnetic energy. And so that just sounded like a mouthful of woo, but there actually is research about this. And what we find with EMFs is that they alter brain frequency. That's another critical thing, too. If you just got one of those smart plugs and all of a sudden your dog is acting like it's nuts, that could be the reason for it. So making sure that you're being careful about how much Wi-Fi signal is present, that sort of thing can make a big difference as well. But what PEMF is able to do is actually restore synchrony and harmony to the electromagnetic field within that biological system. And in this case, we're talking about a dog. So it actually can help support pets and people that are sensitive to EMF waves. I hope that makes some sense. And Sandy, you may have some better things to say about that.
Still working on my layman's terms for that. Essentially, I guess I want people to know that it takes the molecules and the cells in the dog's body, and with that wavelength, it clears out all the gunk, in essence, and it allows those cells to then operate optimally. And I think that's probably the easiest way that I can tell you that it just gets rid of the bad stuff,
Right
and
on.
you can see the difference, which I know you know this, but my old dog Kaya used to actually paw at her pad. We used it for arthritis, and she had a lot of pain, and she would go over and paw at it on the basket, and I would turn it on, and she wanted it on top of her, which you can use it as a mat, and the dog can lay under it if you put it in their bed, or it can just lay over them like a blanket, and that was her preference. But the fact that she knew that is what helped her feel better is amazing, because you can't see it work, you can't hear it work, you just turn it on and you use it. And it's not something that you can only use for a minimal amount of time and then you can't use more. It's like we were talking about the CBD oil. Some pets require more time on the pad. So that's the beautiful thing about having the app is you can adjust that. Do you want to go 15 minutes? Do you want to go 30 minutes? And you just watch the pet and you see how they react and what feels good to them. So if you feel they need more time, then just kick it on for another 15 minutes or until you get that pattern going. But I see the benefits after pets use it, and it's just amazing.
It really is. And it was like I was slow to pick this up because I'm thinking, yeah, this is crazy woo-woo stuff, but it truly does work. And for Hayo, that's been like we move frequently. And so she knows her pad is like her safe spot. So once that comes out of the suitcase, she's laying on that and ready for us
At
to
home.
turn on the stress. Yeah, it is. She knows that's her touch point.
Yep.
And Tanya, no, this is a NASA actually developed this technology for the astronauts to help them combat the low gravity situations and things like that. When Hayo is not using her pad, if I've had a cold or something like this or some issue, she will graciously lend it to me for the night. The cool thing is that you can actually set it to run for 8 hours. And so if I've had a really stressful day and I've got a big fat neck headache or something like that, I will sleep on that thing and wake up feeling a whale of a lot better in the morning. So it's an incredibly useful device for any animal, and not just mammals, but also any other species. So we all have this electromagnetic field. And to your point, that's part of how it works is that it puts that field back in cohesion. But in doing that, then it lets the electrical conduction in the body resume more normal behavior. And so that's what helps those cells start to take in nutrients and dump out the junk. So we start to see better cycles of cell nutrition as well. Cool. What else, y'all? This has been really fun.
Yeah.
Yeah, and yeah, and daughter using hers for herself as well. Oh, cool, Rena. I'm hope so too, because it is so frustrating that the conventional approach really is just sedation, and there's so many other options. And to be fair, the anxiety that pets can experience with cognitive dysfunction is pretty intense, and that makes it very difficult for us, their human caretakers as well. Cool. Any parting words, Sandy? Anything else you
Reach out if you need help because as coaches, we're trained to work with you on this, and not all the supplements that we talked about are needed at the same time. So that's where we can guide you. And let's start with this one. And if we need to add something else to complement it, we will. But there's options, and you definitely don't have to sedate and drug out your dog, or you don't have to euthanize them. You can spend the last time with them and enjoy what you have left.
amen to that. So, for those of you that would like to reach out to Sandy, go head over to drruthroberts.com. You can type in Sandy in the search bar. There's a page there called Work with a Coach or Find a Coach. And Rena is one of our graduate coaches. I think Melissa is on with us. Audrey is a graduate coach. Now, they're all here supporting us in this chat today. But we are 100 strong now. And that this has really just been the thrill of my life to be able to train people to help you in a way that is currently not available. Yeah, Karen's on with us. Yeah. So Tanya, this will be on our Facebook page, so it's easy for you to find. And we have a weekly call with one of the coaches discussing one of these topics. All of those calls are available both on Facebook and YouTube because we want you to have this information. So hopefully, Tanya, I'm glad you were here. It sounds like we were able to offer you some new information, that's our goal, is to give you options.
Get the word.
Yeah, right on. There are options. There always are. And sometimes we have to keep pivoting until we find the right set. So thank you all for coming today. This is a ball. Sandy, thank you so much for coming.
Thank you very
You
much.
are you are just a dedicated woman to getting these guys the help that they need. So
Empowering pet
until
parents.
next,
Oh, sorry.
please, once more. No,
No, I was
please.
just gonna say that is one of the highlights of what I, as a pet health coach, do is empowering pet parents to be able to help their own pets when you feel that you haven't gotten the answers you need. And the excitement that you have when something that you try in an unconventional way, like mushrooms or CBD, works and you see the results. We want to help everybody, and we want to get the word out. All the coaches are amazing, friends with a lot of them, and we talk weekly. So don't hesitate to go on and look for one of them and reach out.
Right on. And if this is something you're interested in learning about, I'm going to drop a link to a page so you can get some more information. But what you'll find when you look at that page, whether you want to pursue the training or not, is that it is not a weekend certificate program. It is actually accredited for 40 continuing education hours for veterinarians and veterinary technicians, which is 2 years of CE credits for us. So it's an intense course. And so the information that these men and women come out with is very in depth and covers a myriad of topics, including functional medicine and traditional Chinese veterinary medicine, um, over all the aspects of the body. So thanks again, Sandy. It was wonderful as always. You all take good care. Give your pups and your kittens a big hug and a kiss for us. Ciao.
Thanks, everyone.